My name is Dismas Udhiambo Wakla, the CEC in charge of Health and Sanitation, Siaya County. To the public, I wish to re-emphasize that Ebola presents a number of symptoms: fever, diarrhea, bleeding from body openings, vomiting, a number of sore throat, rashes, a number of symptoms. So those are the symptoms that we pick. If anybody presents with those symptoms in our facilities, or if we pick anybody with those symptoms in the community, then we screen them to know whether they have any history that can link them to any risk of Ebola. So in terms of preparation, should any case be detected, I want to say that we are ready. We have conducted an assessment on our isolation unit. You will recall that because of COVID, we developed a 310 bed capacity isolation facilities in this county. We are ready. We have done assessment. We can accommodate any cases, and we have also checked our commodities levels with regard to such eventuality, and we have all the necessary PPEs in our stores, the ones that we had procured during COVID and which we are still using up to now. And I think in that front we are prepared, in as much as we are praying that we don't have a case, we don't get any case. Well, we've done mapping to assess our risk, and two fronts are presenting themselves as our weakest link. Number one is the highway from Busia to Kisumu, because that is a gateway from Uganda through Busia, and of course also from Malaba. So we have put two screening points along that highway, one at Sega Market or Township, and the other one at Ugunja Town. I wish to clarify to the members of the public that the screening we are doing is not the thermogun type of screening. We have not reached there yet. It's more of a screening of generating information from people who have traveled from the country that we suspect may bring Ebola. So for instance, people alighting at Sega, we confront them in a polite way and seek to get information from them. That is the kind of screening we are doing right now. The other weak area is our lakefront. That is Lake Victoria, and we are talking about our islands, Mageta in Bondo. We are talking about Usenge Beach. We are talking about Usieko Beach in Bondo, but we are also talking about Kamariga in Rarieda. We have established that our people do a lot of trade across the lake with Ugandans, and they interact every day. So that is another front, another place where we want to intensify. It has started, but it has not picked up, but we want to intensify our screening in that area. Earlier today, my coordinator, Madam Eunice Oreri, who is here, was in lengthy discussion with Bondo MOH in that regard, because we really need to intensify. We have a big challenge with that front because we are dealing largely with fishermen. These are people who do their trade at night, and during the day when you can make contact with them to screen them, they are asleep. So that is a challenge we are doing, but we will overcome it, because we want to deploy, as I've said, we want to deploy our CHVs. As you know, all our CHVs are attached to every household, and therefore using that system and network, we are confident that we will be able to reach out to that population and sensitize them, but also be in a position to pick out any suspected cases that we need to address. So in terms of strategy, we are having a four-prong approach. Number one is coordination, which is already ongoing. We are we have activated all our rapid response teams at county, sub-county, but we want to take it, we are cascading it down to technical working groups at the wards. Number two, we are dealing with surveillance, which is basically tracing any cases or suspected cases that may be in our midst. And number three, we are of course preparing for case management, which I have elaborated. But most importantly, number four is risk communication. And I thank you for coming here this afternoon so that we can have this conversation, because this is one way in which we reach out to our people and tell them, give them useful information about this disease. But in terms of approach, we have also, I met with the county commissioner and his team just to discuss and share notes on this disease, and we agreed that we must adopt a multi-sectoral approach the same way we did with COVID-19, because there are so many things that we can do together. If we combine efforts, our CHVs with the Ngao in sensitization, then you can be assured that within 1 week we will have covered the entire county with the message. So we have agreed in principle that we must work together, we must pull together, because a pandemic, a health pandemic, is a security risk. So it is a matter that we must approach together. Thank you. Question.
My call to action for the people of Siaya is to encourage them that in any case they see or hear of a suspected person exhibiting signs of Ebola viral disease, which includes fever plus vomiting, diarrhea, rashes, and bleeding from the natural orifices, then we encourage them to report through the nearest health facility, and even through the county emergency response number, that is 0800 721 008. I repeat, 0800 721 008. It is free, and you can call anytime to report any suspected cases. And above all, I want to encourage our people to enhance hand washing with soap and avoid being in contact with a person exhibiting any signs that we have mentioned there before.
Yore makamago kaka nyocha mag corona wuok kande. Ero kamano. We started by training our healthcare workers, although a proper training module has not been issued by the ministry, but this afternoon, today in the afternoon, the ministry communicated that they will be conducting the first training tomorrow. But on our part, we started by training our team, borrowing from previous incidences, because the Uganda case is not the first one. We had Ebola cases in DRC, Congo, Sierra Leone, and Liberia, which had put us into a similar alert. So borrowing from that, we have conducted trainings to our healthcare workers, because they are the people who are more exposed to risk, because a lot of times these cases, we detect them in hospitals. But we have also roped in our other lines of defenses, like our CHVs have already been alerted. We engaged them through their structures, through their chars last week on Friday. And I am happy to report that on Saturday, there was a burial in Yiro, in Sidindi Ward, Ugunja sub-county, where a big number of mourners had traveled from Uganda through Malaba. And because of the sensitization which we've given to the CHVs, one of our CHVs was able to pick up that as a case and screened all the 42 mourners who had come from Uganda. So we have developed a screening tool which basically helps us pick useful information from anybody who has a history of having traveled from Uganda or anybody who presents symptoms that are similar to the symptoms that Ebola presents. To the public, I wish to re-emphasize that Ebola presents a number of symptoms: fever, diarrhea, bleeding from body openings, vomiting, there are a number of sore throat, rashes, a number of symptoms. So those are the symptoms that we pick. If anybody presents with those symptoms in our facilities, or if we pick anybody with those symptoms in the community, then we screen them to know whether they have any history that can link them to any risk of Ebola.
Person exhibiting signs of Ebola viral disease, which includes fever plus vomiting, diarrhea, rashes, and bleeding from the natural orifices, then we encourage them to report through the nearest health facility and even through the county emergency response number, that is 0800 721 008.
Yore ma kamago kaka nyocha mag corona wuok kande. Ero kamano.